Weekend Warriors, you're going to want to stick around for this show because we're talking about ways of preventing and treating some common injuries. And it doesn't matter if you're an athlete or if you just like to do some gardening or housework on the weekends. You'll want to stick around because there's some really great information coming up on today's show. We've got a great panel of folks from Bluff Medical Center, including Chelsea Harrison, who's the licensed athletic trainer and the athletic trainer for the Royal School District, Rachel Oldenburg, physical therapist, and Jared Vesperman, also a physical therapist. From the Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We are here at Bluff Medical Center learning a little bit about how to minimize and treat common injuries for the weekend warrior types. And I'm joined by a great panel of folks here from the Bluff team. Welcome, everybody. Thanks for having us here. Chelsea Harrison, you are the athletic trainer here at Bluff Medical Center. You work with student athletes in the area. What types of injuries are you typically seeing in the school setting, and how do students know when it's time to really slow down, take it easy, and even see their athletic trainer or physical therapist?
Right. So injuries, it just depends on the sport. Obviously, we're in summertime now, so people are going to play a lot of volleyball, softball, basketball, those occasional runs, or people do those fun color runs, all that kind of stuff. So there's a lot of ankle injuries, knee injuries, shoulders, elbows, that kind of thing. So it just kind of depends on what, if you use it all the time, so an overuse injury, or if it's a sudden injury, that kind of thing. And when people should seek out, a physician or athletic trainers is when it affects their range of motion. So if they can't reach up to a shelf anymore, they can't walk, obviously, when their strength is lost or limited, it affects their daily life, things like that. Those are key things that you should probably go see a doctor. Along with numbness and tingling. If you ever had any numbness or tingling down your arms or legs, I always refer my athletes to a physician right away so that they can get further help in that I can't do at the school. So. And
if it's happening, especially for a period of time and it's not getting better, that's probably a really good sign that you need to go see somebody.
And everybody knows their body better than I do, so if they notice that something is wrong or off, then it's probably time to get it checked out. So.
Right. Rachel Oldenburg, what about adult athletes who are only active occasionally? We're talking about weekend warriors. They are in a softball league or something like that. Do you have any tips that you can give them?
Well, adult athletes can have all the injuries that Chelsea just discussed, but as our bodies go through that natural aging process, we're also at more risk for back, neck injuries, the spine. And one tip that I really like to give everybody is we spend so much of our time in our day-to-day lives interacting with the environment in front of us, bending forward, bending down. And then if you're gonna spend an additional weekend working in the yard, doing gardening work, bending forward more than you normally do, it's important to take time, slow down, stand up, bend backwards, really stretch everything out. It's really good for your spine health.
Yeah, absolutely. So stretch, 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 it sounds like. Jared Vesperman, there are some things that people of any age can do to reduce their risk of injury when being active. Can you tell us about some of these strategies?
Yeah, no problem. One of the biggest things is definitely warming up before competition. I mean, it not only helps improve decreased risk of injury, it helps you improve initially starting out with your athletic ability, and just you're not spending those first few minutes of the competition getting your body ready to compete.
Right.
Anything that helps raise your heart rate, helps raise your body temperature is good. So it doesn't necessarily need to be sitting and stretching, but just any kind of movement, just a small jog would work. Another big thing is hydration coming in. A lot of people, you need to be hydrating, especially for anything major, a few days beforehand. Just coming in and start drinking some water while the competition already starts. You're already behind the 8 ball. If you start cramping, that's definitely a bad sign. You're not really going to catch up back up from that.
Sure.
Another one is, especially with weekend warriors, a lot of times you don't always have the proper equipment. So having things that are sport specific for that, definitely, if you don't have the proper equipment, it's not going to do you any good.
Right.
And the last thing major is just listen to your own body. We've kind of touched on this already. you know your body the best. You know if something aches and pains, all that kind of stuff. But if something's lingering or really feels wrong, you definitely should get that checked out, especially if it lasts for more than a few days. Even if it's not affecting you a whole lot, it definitely can still escalate into something more if you just kind of let it go.
Absolutely. So I heard in there hydration is one, equipment, and then
Yep.
also listening to your own body.
Yep, and warm up.
And warming up.
For sure.
Warming up.
Yep,
All right.
those 4 things.
We got to take a short break, but we're going to, if you're a do-it-yourselfer, you're going to want to stick around for our next segment because we've got some tips for you at home. Don't go away. There's more Wisconsin Doctors coming up after the break here at Mile Bluff Medical Center. And we're back here at Mile Bluff Medical Center here in Wisconsin Doctors. And if you are a do-it-yourselfer, if you like to take on those weekend home improvement projects or just, basic gardening or weeding or anything like that, you're going to want to stick around because we've got some great tips for you. So, Rachel, I'm going to start with you. Obviously, when people are doing these extreme physical activities that they're maybe not used to because they don't do them during the week, injury is often something that results. What are the most common ways people are injuring themselves that you see?
Typically, do-it-yourselfers are injured doing household work. So a lot of times it's just yard work, things that they're not doing during their day-to-day life, but then on the weekend they try to get this whole project done at once.
Right.
Mowing the lawn, taking care of the garden, weeding, mulching. Also home repairs like painting, roofing, siding, things like that. They put you at more risk of injury because you're not used to the frequency and the duration of that new exercise or activity.
And we talked about that, the repetitive motion, doing something like that. I mean, if you have, if you're not used to using a particular muscle group and then all of a sudden you're overusing it, that can be problematic.
Absolutely.
Yeah. So, Chelsea, are there any things that individuals with pre-existing conditions should think about before they start a do-it-yourself project?
Yeah, so I thought of like 3 main things. So if you have a heart condition, okay, you should know that what your restrictions are. Your doctor should tell you that, and if you don't, maybe talk with them before tackling a project like siding or roofing or something. Having to walk back and forth from the garage to your house or wherever. If you have a heart condition, that might be problematic. Also, asthma is a big thing. People who have asthma, if they have their inhalers nearby, or they should have their inhalers nearby, I should say. Along with allergies, if you're allergic to bees and you're up painting on, the side of your house or something and you get stung by a bee, if you have an EpiPen, I would definitely keep that nearby. So just kind of things like that people should be aware of their own conditions and kind of what they need to help them out in situations. So.
Yeah, know your limits and be prepared for
Right.
adverse conditions. So, Jared, what are some of the symptoms people should learn to watch for while they are working outside? If they're starting to get overworked or anything like that, what are some symptoms that they should look for?
So as Chelsea kind of touched on, obviously you should know some of your pre-existing conditions, so pay attention for that stuff. A lot gets out there about, watching for the heart attack type symptoms, pain in the chest, numbness down the side. I want to talk a little bit more about heat exhaustion or heat stroke. So basic things to watch for with that would be like increased shortness of breath, increased heart rate, dizziness, lightheadedness, nausea. You have like a flushed or just a complete pale face, weakness or fatigue. Also another one, major one for heat exhaustion would be profusive sweating and cold and clammy type skin. That's just the early onsets of that. Now, looking more, the heat stroke is the more advanced phase of that. So basically you can take any of those symptoms I listed off, only now increase them. So now looking for more of a racing heart rate or very, very short of breath, rapid breathing. High body temperature, altered mental status is a big one. And another one that's more in the heat stroke is that you stop sweating. So having like dry skin and not sweating at all, those are really, really serious, and heat stroke can be life-threatening. So if you see anyone exhibiting symptoms, any of those type of symptoms, best thing to do is get them inside to a cool area or in the shade, put a fan on them, some kind of moving air. You can put them, with a cool bath or spray some water on them, a cool beverage to drink, but not usually ice cold isn't recommended beverage to drink, just to help cool them down as quickly as possible.
Yeah, absolutely. So get them cooled off. And Chelsea, what are the typical treatments provided in immediate care for these types of conditions? So if somebody realizes it's time to go to the doctor, what are the typical treatments?
Well, anytime that you get injured, whether it's, heat issues, as Jared said, to go inside, get cooled off. Other types of injuries that you may have, rest is probably the big thing. So go inside, kind of take it easy, don't continue what you're doing. Ice is always helpful. Elevation if you have swollen, or swelling is an issue. Those types of things. So basically just rest and take it easy. If things don't, get better in a few days, then I would probably, suggest going into the doctor again.
It's all very great advice, and we got to take a short break here, but when we come back, we're going to talk about tips for prevention, and we'll have a demonstration or two, so stick around. Welcome back to Wisconsin Doctors. We're here at Bluff Medical Center learning how to prevent common injuries for the weekend warrior. And we're going to do a demonstration for you in just a second. But first, Jared, I want to make sure I follow up with you because we were talking a little bit about heat stroke and dehydration in the last segment. What are some very basic things people can do to prevent these types of injuries?
So looking more at people for just going out and doing yard type work. Obviously, we've already touched on warming up. It probably sounds a little silly before you go outside, but just being a little bit prepared as far as that goes. Also, again, touching back on hydration, want to make sure that you're staying plenty hydrated. We don't want you going out there getting any kind of cramps, any kind of the heat stroke and stuff. Also, we've already touched on this again earlier, is listening to your body. You know if something's going wrong at all.
Yeah.
So, taking time, the project will always be there the next day, a little bit later on. You don't need to get all done in one day.
Right, exactly. Taking it easy, in other words.
Yes, exactly.
And as far as hydration, I remember my high school health teacher saying, if you feel thirsty, you're past the point where you need to take a drink of water. So, okay, so we're going to do some demonstration. This is called dynamic warm-ups, as I understand. So give us a little bit of an explanation of dynamic warm-ups and their uses.
All right, so a dynamic warm-up, basically it's a series of specific movements designed to warm up the muscles that you're going to be using for that sport. The reason that's important is because we don't want to spend that first few minutes of that competition getting ready to compete when you're already competing out there.
Right.
Essentially, again, raise your heart rate, raise your body temperature, and targeting the muscles that you want to do. So we have a few demonstrations now.
All right.
We're going to start with a little bit lower level stuff.
Okay.
More based on, before maybe going out to doing any kind of yard work or anything like that. And then we'll try our best with our limited amount of space to show a little bit more activity for.
Okay. Did you want to hold on to that?
No, we can set that right
Great.
there.
Okay, perfect.
Alrighty. So starting out, something easy that you can do would just be doing something simple like a body squat. Okay. So just arms out in the front and just squatting down. Now, people might say, "Oh, I have bad knees, I have bad ankles." You don't have to go as low as you can. Just go down a few times. As far as how many you do, you can do 5, 10, whatever number feels good for you. Next one that's a good one to do is just doing some marching. Lifting those knees up. Now, to progress this a little bit more, you can even come in and grab and pull a little higher to get a little bit bigger stretch, get those glutes working a little bit more.
There we go. Yeah, feeling it.
Alrighty. So, another good one that I really like to work on the hamstrings a little is just doing a nice little kick.
Okay.
Now, start out a little bit low in the first few because I can feel pulls back in here.
Okay. Now, you wanted to go kind of across your body or
across, or you can do two hands, whatever feels comfortable for you. I like just going across usually.
Oh, yeah.
Yeah, you can feel that pull a little bit. Alrighty, that's good. So, we've been doing a few leg things. Now we're going to do a few more arm ones. I'm just going to turn sideways to show a little bit more. Basically, all you're going to do is just go back and forth. I know this is the classic Michael Phelps where he bends over and does that.
Sure.
We're not quite that, moving that much. Another good one would be just doing windmills forward. Okay. We can also go backwards.
And this is just to kind of get your, like you said, get your body temperature up a little bit and get your blood flowing, get your heart rate up a
It's
little
nothing, you shouldn't be tired after doing something like this. You should just, like you said, just increase the metabolism a little.
Right.
Now, for more sport specific, you can do things just simple as add in a little skipping. Now, we don't have a lot of room to skip here, but just do the arm swings and just do a little skip as you go forward.
I like this.
You can also do that again backwards. Yeah, exactly. You can add in anything like that. Again, if you want to do just a big knee skip forward, you can just go forward and just go down the hall. Anything like that, like I said, just to get the blood moving. Thinking back to softball, obviously just doing soft toss too. Just tossing, starting out slow and working your way up to throwing harder and harder. That's a good way to look at things.
Right. Going in cold, never a good idea, it sounds like.
No, it does not.
Well, when we come back, we're going to do some stretch demonstrations with Rachel. So don't go away. There's more coming up right here after the break at Mile Bluff Medical Center. Welcome back to Wisconsin Doctors. We're here at Mile Bluff Medical Center learning about ways of preventing common injury for the weekend warrior. So we've got another demonstration. We learned a little bit about dynamic warm-ups in the last segment, but now we're going to learn about static stretches. So Rachel, talk to us a little bit about static stretches and their uses, and then the differences between dynamic warm-ups and static stretches.
Absolutely. Static stretching is a type of stretching where you hold for an extended period of time. So the goal is to do after exercise when those muscles are already warm, lengthen them, improve your range of motion, and it can also be used therapeutically to get rid of muscle cramps.
Okay.
It does differ a little bit from dynamic warm-up because dynamic warm-up is getting your body ready for competition.
Okay.
It's warming up the muscles, warming up the tissue temperature, where static is more cooling down the body and stretching to increase your range of motion.
Okay.
Now, typically, static stretching, research will say hold the stretch for anywhere from 15 seconds to a few minutes.
Okay.
Most commonly prescribed is that 30 seconds range. That gives your body enough time to actually lengthen the muscle tissue.
Sure.
So we'll go through a few examples.
Absolutely. Let's do it.
All right, so the first one that I have for you guys is a quad stretch. So stretching that muscle in the front of the leg. So what you're going to want to do is you're going to stand, hold your ankle, pull it back. You can absolutely hold on to your neighbor or something nearby so that I don't want anybody falling over. The goal is to have your knee right underneath your hips. So you don't want it up in front.
Okay, so underneath the hip.
Until you feel that strong stretch down in the front of your leg.
Okay, yes, I'm feeling it.
Yeah, and then we'd hold that position for 30 seconds, and obviously you're going to want to do this on both legs.
Right, make it even.
After exercise, so once that tissue is already warmed up.
Sure. Now, is it okay or recommended to do a dynamic warm-up and then do some stretching before going and doing the main part of your workout?
You absolutely can, but the stretching is more for lengthening the muscle tissue, so it's not needed to be done before you do the work that you're planning on doing.
Got it. Okay.
Yeah. So then the one for the upper body is a cross arm stretch.
Okay.
So keeping that arm either straight or bent doesn't make a difference to me.
Okay.
You're going to pull across your chest.
Go this way.
Yeah, stretching that muscle in the back of your shoulder and upper back.
Okay.
Again, we'd hold for 30 seconds and we perform on both sides.
Okay. And does this help with shoulder injuries that you've seen?
Absolutely, it can.
Great. Yeah. Feels good. Feels good. So you also have a few stretches for sitting that you can show us.
Yes, we do.
Okay, so we'll take a quick second to reset and then we'll show you some sitting stretches. Okay, so we're sitting down and we're going to do some static stretching on the floor. So what do we do now?
Yes, we are. So the first stretch that we're going to do is for your hamstring.
Okay.
So you're going to place one leg out in front, flat on the floor, toes up straight towards the ceiling.
Toes up straight, okay.
Nice posture, sitting up really tall, and you're going to lean forward, reaching for those toes, bending at your hip. It doesn't matter how far you go. You just want to feel that stretch in the back of your leg.
Okay.
You know it's a good amount of stretch when you can really feel it back there.
Sure.
But it's also tolerable enough so that you can hold the stretch for a 30-second period of time.
Sure, okay.
If it starts to ache or you're finding yourself working out of that position, you're probably leaning too far forward already.
Right, and sometimes, I've often just kind of leaned forward with my back like this. Is that something that you want to avoid?
I want you to sit nice and tall.
Okay.
Keep that better posture throughout the movement and bend at the hips.
Okay, bend at the hips. I can do that. All right. Yeah.
Yeah, you feel that? Okay.
I'm feeling it.
Here's the second one. I have another one for you.
Okay.
So this is called a butterfly stretch. So what you're going to do is you're going to put your feet together, knees apart. You can pull them in as close as you want, and then you're going to let your body drop your knees down towards the floor. So let gravity separate your legs. This is opening up your hips and stretching those muscles in through there.
Okay.
Yeah, again, we're holding for 30 seconds here.
And is it, I mean, again, you want to try to sit up here
Yes,
as much
you do.
as possible.
Always good posture.
It's interesting because I've heard it the other way around where you want to try to stretch this way as much as you can, but that's not the case. You want
Not
to try
for
to,
everyone. Some people that is a priority, but for the general population, sitting nice and tall is a hip stretch.
Sure. And are there any modifications that you could make for people who maybe don't have as much flexibility?
Absolutely. And to go through those specific cases, or if you're having problems with flexibility, come into the hospital. See your
Sure.
physical therapist, the athletic trainer, the occupational therapist, and we can give you those modifications depending on what your needs may be.
And you guys have given some great tips on how to prevent injury, but let's say, you know, it happens, somebody gets injured, they push themselves too hard, what should they do?
Come and see us. We're happy to see everyone. We have, you know, those athletic trainers, more for the high school students, or people that have occupational health needs, and then the physical therapist, and we'll be more than happy to give you the right stretches, strengthening exercises, and they're custom fit to whatever your needs may be.
All right, folks, well, stay safe this summer, but if you don't, come and see these fine folks. So this has been Wisconsin Doctors here at Mile Bluff Medical Center. I've had a great team of folks with me here, Chelsea Harrison, Rachel Oldenburg, and Jared Vesperman. Thank you so much for the information and for the demonstration.
Yeah.
We appreciate that.
Thank you.
That's all the time we have for Wisconsin Doctors. From all of us at Mile Bluff Medical Center and Wisconsin's 57 Television, we invite you to live longer, live better. We'll see you next time.